Hi, I'm Dr. Neha Mangla at Smile District in Philadelphia. A lot of patients ask questions about crowns, so today I'm here to answer all those questions about crowns. The main reason for putting crowns over the teeth is that teeth start to break down. When you put a cap, a crown on a tooth, it makes it strong so that the tooth does not break under excessive forces. The reason we do crowns on a tooth is to give extra strength to a tooth. There are mainly three situations when we put crowns on a tooth. One is when there is already an existing crown on a tooth and there is a cavity that starts to happen under that existing crown. Now, in that situation, we have to remove the old crown, remove the cavity, and then put a new crown on the tooth. The second situation is where the tooth already has a very, very big filling on it, and now there is cavity starting to happen under that existing big filling. We put a crown on the tooth after removing the cavity to give additional strength to the tooth. The third reason that we put crown on the teeth when there are crack lines, fracture lines starting to happen on a tooth. Because if the tooth has a vertical fracture and it goes deep enough, then the tooth fractures and breaks to a point where the tooth cannot be saved. So before that situation happens, we want to put a cap over the tooth so that the fracture line does not propagate enough for the tooth not to be saved. Usually it is recommended to have a crown after a root canal has been done on a tooth. The studies have indicated that after the root canal has been done, the tooth becomes more brittle and there are higher chances for the tooth to break down. So in order for us to prevent that from happening so that you can have your tooth for a long, long time, so that you can enjoy food, is to put a cap, a crown on the tooth so that the tooth does not break down by excessive forces acting on the tooth. Crowns are actually much more stronger than the normal teeth. If you already have a crown on a tooth, it's going to take me a little longer to remove the crown versus working on your own natural tooth. So you're giving added strength to your tooth by putting a crown on it.
What are the steps of a dental crown?
So you come in one visit. I'm going to first of all numb you. Then we wait for 5 minutes so that you're comfortable and you don't have any pain while I'm working on you. Then we get started with the work. We prep the tooth on all the sides so that the crown can fit over your normal tooth and still the size of the tooth remains the same once the crown is put on. So once we have prepped the tooth, we take an impression or scan to send to the lab for them to make a permanent crown for you. Once that is done, we make a temporary crown for you. Then you come back after about 2 to 3 weeks. That's when we remove the temporary crown and put the permanent crown on. During these 2 to 3 weeks, I tell you some do's, some don'ts, some instructions that you have to follow. For example, no hard, crunchy, sticky foods, no nuts, no candies, no chewing gum. Prefer eating on the other side. You have to gently brush the area and keep it clean, but follow the instructions because the temporary crown, it looks like a normal tooth. It's not. Once you have the permanent crown, there are some instructions that I want you to follow. Everyone should brush their teeth twice daily, at least once in the morning and once at night. Everyone is supposed to floss at least once daily. But there is a special way to floss when a permanent crown is put on. When you have a permanent crown put on for the floss, you go in and you pull out. You go in and you pull out towards the cheek. Some people, what they do is they go in and they pull out like this. Now, if you're pulling out like this, nothing happens in a day or a week, but over the period of months and years, that action of opposite direction of forces can sometimes break the bond between the tooth and the crown, and then there are higher chances for the crown to come off. So, never do floss like that around a crown. You go in and you pull out towards the cheek. We can tell if there is a decay under the crown by 2 ways. One, we do an x-ray every time you come for your cleaning, and with the x-ray, it sometimes shows us if there is a cavity happening under the crown. In some rare instances, that decay might not show on the x-ray if the decay is especially happening towards the cheek or towards the tongue. In that situation, we can see in your mouth and check with the instruments to see if you have a cavity under the crown. Sooner we catch it, sooner we will be able to help you. Because if we let the cavity stand there, you're going to lose that tooth eventually. We don't want that to happen to you. For the average life expectancy of the crown, like anything in life, the good care you take of anything is going to last you longer. You take good care of your teeth are going to last you longer. You take good care of your crown is going to last you longer. Now, how can you take good care of the crown? It is very, very important for everyone to get at least 2 cleanings a year. One thing is, if a cavity starts happening around the crown, we want to catch it sooner than later. Other things that you can do is what you do on a daily basis at home. Like I said, I want you to brush twice daily, once in the morning, once at night. Flossing at least once daily is a very, very must. Are you ready to take good care of your teeth and crowns? You can schedule an appointment to get the crown done at our office at 215-725-8901. Or you can email us at smiledistrict.busselton@gmail.com. Or you can reach our website, which is mysmiledistrict.com, and leave your contact information, and the staff members are going to contact you to help you make an appointment with us.